Amblyopia or lazy eye is a condition in which one or both eyes have weak vision. This weak vision is because of the poor development of the vision centers in the brain. Traditionally, amblyopia was treated with patching. In fact, it is still treated with patching, wherein we patch the good eye so that the weak eye is forced to see things, and while this weak eye is being forced, the vision centers in the brain develop. Recently, computer exercises have been introduced where both the eyes as well as individual eyes can do these exercises, and again these improve the vision centers in the brain. Both these exercises have followed a bottom-top approach wherein you stimulate vision and therefore the vision centers develop as a result of that. So first the eye is stimulated or the retina is stimulated and then the brain is stimulated. There is, however, a new treatment for lazy eye called Orthoptek, and this technique follows a top-bottom approach, which means that when we perform the exercises, multiple areas in the brain are stimulated, which in turn will develop the vision centers in the brain. The exercise has two parts. In the first part, the patient has to look at the light but follow the peripheral lights as they come on. These peripheral lights come on for about 300 milliseconds. The patient starts with the better eye while the weaker eye is covered, and he performs the exercise for 2 minutes. After that, the patient covers the better eye and performs the exercise with the weaker eye for about 20 minutes. After that, both eyes are open and the exercise is performed for 5 minutes. This concludes the first part of the exercise. In the second part, the patient has to again look at the central red light and not move the eye from there. The peripheral lights will come on and go off randomly, and the patient has to count the number of times he sees the peripheral light while he is looking at the red light. So he first does the exercise with the weaker eye and counts peripheral lights up to 400 times. He then does the exercise with the strong eye, covering the weak eye, and he counts up to 200 times the peripheral lights coming on. And then he opens both eyes and counts the peripheral lights for 200 times. That concludes the second part of the exercise. Each session lasts for about 40 minutes, and you should note that the number of times that we ask the patient to count the lights would depend on the severity of amblyopia. Your therapist can decide the duration of therapy based on the child's vision and severity of amblyopia.